Now going back to our COVID-19 watch, the health department warns that daily COVID-19 cases may hit 2,000 by the end of December. That's if compliance to health protocols decline. Let's find out more about these projections and the latest COVID-19 situation in the country. We will speak to OCTA Research Fellow Guido. Good morning, Professor. Thank you for joining us on New Day. And we were saying before the break, you know, when you are on the show, it's either good news or bad news. So please tell us, what is your assessment on DOH's projection? Do you share similar projections with the health department?
Actually, yes, Ria. We're foreseeing that cases could be rising to more than 2,000. Maybe it might even reach up to 3,000 cases per day. The reason is that the Omicron subvariant BQ.1 has already been detected in the country. And this has caused a wave or a surge in other countries, like in the US, 50% of cases are the BQ.1. So it's a highly infectious subvariant. And it has a high immune escape. So that means prior infection will not necessarily protect us from getting reinfected again. And even vaccinations will not necessarily protect us from getting reinfected. Although vaccinations still provide a high level of protection against severe infection. But that being said, testing is now much lower compared to the past year. And so, we're not testing as much anymore for RT-PCR testing because a lot of people are using antigen testing. And that's why we won't see the same number of cases that we were seeing last year. But we're expecting more or less a similar wave to what we just saw in the past few months with the XBB and the BA.5.
All right. So now that, we are seeing a possible increase, should we be testing more? I mean, if somebody has symptoms, do we sort of say, okay, well, it's just a cough or a cold, or should they be testing themselves right away?
Well, it is highly infectious. So when people are feeling symptoms, they should actually be self-isolating if they're not getting themselves tested. Now, we are actually testing a lot, but a lot of people are using antigen testing nowadays because it's a lot cheaper, it's faster, it's portable. You don't need a laboratory for that. Unfortunately, the antigen test results don't get included in the official number. In other countries, they have already incorporated antigen test results to their numbers. So they're seeing more, like in Japan, they're seeing a wave right now, a surge. And in China, they're having the worst surge right now compared to the past 2 years.
Right. But back here on local shores, how is the Philippines doing in terms of positivity rate right now? And could you tell us about the areas that are recording a sharp increase?
Yes, Ria, and that's why we're relying more on the positivity rate to determine the trends, because the positivity rate is very accurate. And for example, in Metro Manila, the positivity rate went up from 7.5% in November 19. Now it's up to about 11.4%. So it is registering an increase. It's not that high yet, but it is going up. So despite the lower number yesterday, we'll probably be seeing higher numbers today and maybe the next few days. We're also seeing higher positivity rates in areas like Benguet and in Kalinga, also in La Union. So some of the northern areas, Ilocos Sur and Ilocos Norte is also seeing an increase in positivity rate. And in some other areas like in Cebu, the positivity rate is still lingering a bit high.
Given all of that, we dropped the mask mandate. It is the holiday season. You've got parties and get-togethers, really starting to happen now. Do you think that the government should bring back tighter restrictions to prevent worse scenarios? Because if you recall, last year after the holidays, there was a huge surge.
Right. Well, we're not expecting the huge surge, Ria, but we are expecting infections to increase over the holidays. Unfortunately, this time around, unlike in 2020 when there was no holiday surge, and in 2021 when there was no holiday surge, but there was a post-holiday surge, this time we might actually have a holiday wave, if it's not called a surge. But tighter restrictions will not necessarily help unless they're extremely tight. And that would not be good for most of the people because most of the people will have mild or asymptomatic level of infection. In fact, only about 2% are getting severe or critical. But that being said, some people will still be getting severe or critical. And although we can't change the restrictions for these people, our advice is to just generally, follow health protocols, wear the masks, especially in crowded areas and maybe indoor areas. So it's optional, but people can opt to wear the face mask to protect themselves. So it's like we're saying there's a storm signal number one, it's not going to be a very strong storm, but people should maybe protect themselves, like bring an umbrella or something. So it's the same thing here. We defer now to the public to do what they think is right for them. And there's going to be gatherings, there's going to be parties. We can't help that, but at least people should be mindful, and they should be careful, at least cautious with their masking and social distancing and everything. So at least they could prevent transmissions. And those who are feeling symptoms, like you mentioned, maybe they should self-isolate or get themselves tested.
All right, agree with everything you said there 100%. Thank you so much, OCTA Research Fellow Professor Guido David.